This recording is the muscular system, part 3 of 4. Coracobrachialis is a muscle that originates on the coracoid process of the scapula and inserts on the medial shaft of the humerus. The action of coracobrachialis is flexion of the shoulder and adduction. Flexion and adduction of the shoulder. Coracobrachialis is a synergist of pectoralis major. Remember that when a muscle has the name of its attachments in the name of the muscle, that might be something I would tend to use on a test in terms of origin and insertion. Remember, the term brachii means arm. So coracobrachialis going from the coracoid process of the scapula to the medial shaft of the humerus. If we look at this picture below, you can see the muscle coracobrachialis highlighted on this model right here. Biceps brachii is named because it has two origins or two heads. The long head of biceps brachii is more lateral, the tendon of which rides through the intertubercular groove to attach to the glenoid cavity or glenoid fossa superiorly. The short head of biceps brachii has a tendinous origin attached to the coracoid process of the scapula. The insertion of the entire muscle is on the radial tuberosity of the radius. Therefore, biceps brachii can assist in elbow flexion and also supination of the forearm at the elbow. There are other muscles that help to supinate the elbow, which would be prime movers or agonists. Biceps brachii, because it crosses the shoulder joint as well as the elbow joint, can weakly flex the shoulder. Brachioradialis has its origin on the lateral supracondylar ridge of the humerus and inserts on the styloid process of the radius. Remember that the radius is lateral in the forearm, therefore it would make sense that the origin would be on the supracondylar ridge laterally on the humerus and then inserting down on the styloid process of the radius. Brachioradialis helps to flex a semi-pronated forearm. This forearm is semi-pronated. Here we have full pronation, full supination. This is semi-pronation. And brachioradialis helps to flex a semi-pronated forearm at the elbow. If you raise your elbow when your hand is in a semi-pronated position, you can feel brachioradialis moving there. Here we can see brachioradialis on the mannequin. If you watch my videos on these muscles, you get a better idea of how to orient yourself with those models and understand that when you're looking at the thumb side of the model, you can see brachioradialis more easily. This is a lateral view, which is not easy to demonstrate. Brachioradialis helps to stabilize the elbow during biceps curls. Here we have brachialis. Brachialis is considered the prime mover of elbow flexion. It originates on the distal anterior aspect of the humerus and inserts on the coronoid process of the ulna. Remember, the coronoid process is that little pointy piece of the ulna anteriorly that will go towards the coronoid fossa. Brachialis is a rather thick muscle. When you look at it in the lab with the biceps brachii removed, you can see brachialis deep to it. Triceps brachii is the muscle found on the posterior aspect of the arm. We know this is a posterior picture on the left side because we can see the spine of the scapula, and we can see that also on the picture on the right. There are 3 heads to triceps brachii. A long head, which has its origin on the glenoid fossa of the scapula, the inferior portion of the glenoid fossa. We have a lateral head, which has its origin on the lateral posterior portion of the shaft of the humerus. And we have a medial head. The medial head has its origin on the distal posterior shaft of the humerus. This muscle inserts on the olecranon process of the ulna, and its action is elbow extension. In fact, triceps brachii is a prime mover or agonist for elbow extension. These terms that we use are related to either the motion of the muscle or the motion described. If I asked you to name the agonist for elbow extension, well, that would be triceps brachii. If I were to ask you for the agonist for elbow flexion, that would be brachialis. If I tell you that the motion is elbow flexion and ask you to name the antagonist, I'm asking for you to name the muscle that works in the opposite direction, which would be extension, which would be triceps brachii. It's really all relative to what is being described, and you have to pay very close attention. If you want to work with me and do some examples of this online on Blackboard Collaborate Ultra, please let me know. Maybe we can get a little class together and go through some of these. Pronator teres is a muscle in the forearm that helps to pronate the forearm at the elbow. Remember, the motion is occurring at the elbow. The origin of pronator teres is the medial epicondyle of the humerus. Remember how the medial epicondyle is this lump that sticks out medially on the humerus as you approach the forearm? It also has an origin on the coronoid process of the ulna, which you cannot see in this picture. The insertion is the lateral aspect of the radius, and again, the action for pronator teres is to pronate the forearm at the elbow. On the mannequin, we can see pronator teres very clearly marked right here. Remembering that pronation is turning this way, if you look at the mannequin with the palms facing upward and know that the thumbs would have to turn downward immediately, that can also help you orient yourself for pronator teres. Flexor carpi radialis is a muscle that runs along the lateral aspect of the forearm. It originates on the medial epicondyle of the humerus and cuts across this way to flex and abduct the wrist. It originates on the medial epicondyle of the humerus. However, the insertion is going to be at the base of the second and third metacarpals. Remember, the carpals make up the wrist, the metacarpals make up the palm of the hand. So the base of the second and third metacarpals, which is why it will flex and abduct the wrist, because it's laterally oriented. It does flexion, abduction. On the model in this slide, you can see Flexor Carpi Radialis right here. The next muscle we're going to discuss is Palmaris Longus. Palmaris Longus is a muscle that goes straight down towards the center of the palm. Palmaris Longus also originates on the medial epicondyle of the humerus and comes down the forearm medially, forming a tendon that goes through the carpal tunnel, which fans out. The insertion of Palmaris Longus is going to be the palmar aponeurosis, as well as the skin and the connective tissue, the fascia of the palm. Its action is simply wrist flexion. This is Palmaris Longus right here. Next we have Flexor Carpi Ulnaris. Remember, the ulna is medially oriented closer to the pinky, the fifth digit. The origin of Flexor Carpi Ulnaris is also the medial epicondyle of the humerus. It also has origins on the olecranon process and the posterior portion of the ulna. The insertion for Flexor Carpi Ulnaris is going to be the base of the fifth metacarpal, as well as pisiform and hamate. The action for Flexor Carpi Ulnaris is flexion of the wrist and adduction. So we have flexion and adduction of the wrist with Flexor Carpi Ulnaris. It's easy when you remember that ulnaris is medial, so we do flexion adduction, whereas Flexor Carpi Radialis is going to be more lateral, so we have flexion abduction. The next muscle in the forearm we're going to discuss in terms of the flexors is Flexor Digitorum Superficialis. If you look closely on the models, you can see on either side of Palmaris Longus tendon, which here's the Palmaris Longus muscle, on either side you can see some muscle. This bit of muscle poking out here, and on the other side, that is all part of Flexor Digitorum Superficialis. It originates on the medial epicondyle of the humerus, as well as on the coronoid process of the ulna and part of the shaft of the radius. The insertion is going to be the middle phalanges of digits 2 through 5. Remember, we have proximal, middle, and distal phalanges. That means that we have our metacarpophalangeal joints, our proximal phalangeal joint, interphalangeal joint, and our distal interphalangeal joints are the last joints in the digits. The action of Flexor Digitorum Superficialis is flexion of the wrist, flexion at the metacarpophalangeal joints, which make up your knuckles, and flexion of the proximal interphalangeal joints of digits 2 through 5. Flexor digitorum profundus is a deeper muscle. It is deep to flexor digitorum superficialis. We have to take off the superficial anterior flexor muscles to see flexor digitorum profundus. Flexor digitorum profundus originates on the coronoid process and the anterior medial surface of the ulna and inserts on the distal phalanges of digits 2 through 5. Therefore, its action is flexion of the distal interphalangeal joints in fingers 2 through 5. Because it's profound and deep, it goes farther. Flexor Palmaris Longus is a muscle that serves to flex the thumb joints. You can see thumb flexion in this picture. The origin for this muscle is on the anterior surface of the radius as well as on the interosseous membrane between radius and ulna. The insertion is the distal phalanx of the thumb to flex the thumb joint. This takes us to our extensors on the posterior aspect of the forearm. First, we have Extensor Carpi Radialis Longus. Extensor Carpi Radialis Longus originates on the lateral supracondylar ridge of the humerus and inserts on the base of the second metacarpal. Its action, because we're talking about Extensor Carpi Radialis, its action is to extend and abduct the wrist. So Extensor Carpi Radialis Longus will extend and abduct the wrist. I don't know if you can see this. Now we have Extensor Carpi Radialis Longus. We also have Extensor Carpi Radialis Brevis. On this model, this muscle is Extensor Carpi Radialis Longus. This is Extensor Carpi Radialis Brevis. Extensor Carpi Radialis Brevis does the exact same thing as Extensor Carpi Radialis Longus. They both extend and abduct the wrist. Again, the origin for Extensor Carpi Radialis is the same in terms of the lateral epicondyle of the humerus, and it inserts on the base of the third metacarpal. This muscle, if you recognize right here, is Brachioradialis. This takes us to Extensor Carpi Ulnaris, which is going to be an extensor muscle that goes towards the pinky side of the hand. Its origin is the lateral epicondyle of the humerus and posterior ulna, but the insertion is the base of the fifth metacarpal. This extends and adducts the wrist, because remember, in anatomical position with the palm facing anteriorly, the back of the hand facing posteriorly, we have extension, and now with my, I'm going to have to move my hands up this way. Okay, we're going to do extension and adduction because the ulna is medial, so we have extension and adduction of the wrist for Extensor Carpi Ulnaris. This takes us to Extensor Digitorum. There is a somewhat flat muscle that goes toward the back of the manus, and you can see it also fans out with tendons, and this is Extensor Digitorum. Extensor Digitorum originates on the lateral epicondyle of the humerus, inserts on the distal phalanges of digits 2 through 5, and it is responsible for extension of the wrist and the fingers. This takes us to extensor Palmaris Longus, which has its origin on the dorsal shaft of the radius and sometimes the ulna and the interosseous membrane between the two bones. It inserts on the base of the distal phalanx of the first digit and is responsible for extension of the thumb. Extensor Digiti Minimi is a tiny little muscle that has its origin on the lateral epicondyle of the humerus and inserts on the distal phalanx of the fifth digit. It's a tiny little muscle that's usually seen in between Extensor Digitorum and Extensor Carpi Ulnaris. The action of Extensor Digiti Minimi, as this inserts on the distal phalanx of the fifth digit, is to extend the fifth digit. It is sometimes referred to as the tea drinker's muscle. Abductor Palmaris Longus has its origin on the posterior surface of the radius and the ulna, as well as on the interosseous membrane between those two bones. The insertion is at the base of the first metacarpal and trapezium. The action of Abductor Palmaris Longus is to abduct the thumb. The action is in the name. Abductor is going to abduct. Pollicis, thumb.